Welcome to SVG-TV's news for Tuesday, April the 7th, 2020. I am Bhavin there with the details. SVG has recorded its 8th COVID-19 case today after additional COVID-19 results were returned from the Caribbean Public Health Agency, CARPHA. In a release from the Ministry of Health, it stated that this case is another imported case. The positive result was an additional 4 samples that were sent for COVID-19 testing. 3 tested negative. The release noted that the patient who tested positive is a Vincentian national and has been in isolation since the sample was taken for testing. The patient is being monitored and all close contacts have been identified. All additional public health measures, including the implementation of additional quarantine, will be applied where required. There are currently 7 active cases, with 1 patient making a full recovery from the disease. The public is reminded to continue to practice the basic but highly effective public health measures of hand hygiene, cough etiquette, physical distancing, and strict adherence to quarantine. And as the Ministry of Health continues to encourage persons to practice social and physical distancing, an infectious disease specialist says the sight of guidelines must be taken more seriously. Despite a noticeable reduction in the number of persons seen on the streets of Kingstown, there are still long lines at various institutions in the capital. Infectious disease specialist Dr. Davy stressed the importance for persons to adhere to social and physical distancing guidelines.
To start moving towards and start getting used to is the fact that we shouldn't be doing so much of this walking about. But let's say, for example, you have your bills to pay. You try and pay all of them the same day, so you have 1 episode in town. You don't want to pay the VINLEC bill today and the CWSA bill tomorrow. You try to bundle all your duties. And also when you're standing in line, I know some of the business places have been quite good and they've been putting markings on the floor so they ensure that people are staying some distance apart from one another. But not all of them have that. But what we're really looking for is a distance of more than 3 feet, preferably 6 feet. So if you think of somebody who's tall, 6 feet tall, and that person is lying on the ground, about that distance. It's quite a bit, but it's for everyone's protection. And as I said, if you can limit the amount of times that you have to come and bundle together in Kingstown, that will be great. Because we do know that every 1 infected person can give 3, and then that multiplies and we have that effect over and over again.
While commending the many institutions which have implemented measures to encourage good hygiene, Dr. Davy said there are other important tips these institutions must be aware of and follow.
Everything there is a shared responsibility. Not everyone knows what 3 feet is or looks like, or 6 feet. So if they can do it on the inside, perhaps they can extend it to the tents that they have on the outside, that you put the measurements on the ground. That would help out a bit. And I commend them also for installing the hand washing stations around. That's very good as well. As the hand washing stands placed outside is not for you to just wash your hands and run off. You should do all of the proper techniques, ensuring that you cover all bases of your hands, the fingertips, the thumbs, everywhere, as shown.
Meanwhile, the infectious disease specialist is reminding persons that unclean gloves is the same as unclean hands. Noting that wearing gloves can give a false sense of security, Dr. Davy explained the best way to remove gloves without contamination.
The gloves, I know I see people wearing gloves and it perhaps gives a false sense of security because you're touching everywhere and everything with the gloves. You're not changing them every time. So unwashed gloves is the same as unclean hands. So we should watch that as well. Alright. So I'm going to show you how to properly remove a pair of gloves. These are nitrile gloves. You know that there are different types, nitrile, latex. So what you should do is take a pinch on the outside, right? So you're pinching and you're bringing it forward. And you're making a ball in that hand. And with this clean finger, because hopefully your hands weren't contaminated, you're going under the edge of this glove. So you notice all of the infectious part, the parts that were exposed, and you're not going to touch that. And then you place in a bin. That's how you remove the glove properly.
The infectious disease specialist also encouraged persons to clean their groceries before opening or consumption.
Yes, I actually saw this morning a video someone sent to me where they were talking about cleaning the items that you get from the supermarket, because it's possible that viral entities can live in your refrigerator. And although no studies have been completed on COVID-19 and as to how long it will live in your refrigerator, I always find it good practice before you open in cans, certain plastics, they should be wiped down when you come from the supermarket because you don't know where they were stored and how they were stored. And of course, we have had incidents of people possibly getting leptospirosis or the like from cans that were left in a storeroom where rats would have done their doom. So it is also good practice outside of COVID-19 as well to clean your items.
Due to the suspension of outpatient services at the Milton K2 Memorial Hospital and the Modern Medical and Diagnostic Center, patients are being asked to note that they will be contacted by the steward's offices of the MCMH and the MMDC individually. Please note there is no need for you to visit the district health centers unless you need emergency care. In light of the ongoing COVID-19 pandemic, the Ministry of Health, Wellness and the Environment continues to promote physical distancing. Please do not leave your homes unless necessary. Do not attend district clinics unless necessary. Please call your local health center for information and repeating prescriptions. Effective tomorrow, Wednesday, April the 8th, 2020, omnibuses under the umbrella body of the Vincentian Transport Association, VINTA, will be withdrawing their services for a period of 2 weeks. The organization said this is due to safety concerns in the wake of COVID-19 in SVG. Passengers are being asked to make alternative transportation arrangements for the 2-week period. President of the Vincentian Transport Association, Royron told SVG-TV News that members made the decision to withdraw their service during a meeting last Sunday as they felt the high risk of being exposed to COVID-19.
We consider 5 major issues. One, the recently announced 6 new cases of COVID-19, the vast number of quarantine persons to date, the expansive contact tracing being conducted by the Ministry of Health as it relates to one of the cases, the plea of the government for all citizens and businesses to do what they can to limit the spread of the virus, and the impact of our decision on the essential workers. The membership believe that their own health and interests of their family outweighs, in particularly, exposing themselves to move essential workers. And with points 1 to 4, those points were sufficient for them to make a decision to suspend their service or withdraw their service as of tomorrow.
Adams said they will continue to work with the Ministry of Health in following the social distancing guidelines. He further noted that while the government has implemented reduced passenger intake for omnibuses, it is difficult to practice physical or social distancing based on a set of guidelines.
There is no social distancing in a minibus. It just cannot happen. Whether you have 1 person in a row, 2 persons in a row, it is impossible. There are buses that have been trying to comply with those recommendations of the reduced capacity, but there are still significant amount of buses that continue to breach the recommended capacity, which is not good for the health of St. Vincent and the Grenadines and for reducing the spread of COVID-19.
Abrams said the association has already informed the government of their intent to withdraw their services. While making it clear it is not a strike, the VINTA vice president is appealing to omnibus operators in the country to support the decision, which he said was taken in their best interest. He has also asked for the government and passengers' understanding.
To understand that the risk associated with the spread of COVID virus is multidimensional. In fact, more so that the minibus industry can be both a catalyst and a conduit for the spread of the virus if not properly managed. The traveling public, bus owners, drivers, conductors to understand that tomorrow's decision is critical to stem the spread and flatten the curve of COVID-19. And it is a public health appeal to all minibus owners and drivers to ensure that the measures that we are taking in suspending our services is executed tomorrow, and that the public understand the clear intent of our decision for tomorrow.
Operators of tour buses and taxis will receive some relief from the economic fallout created by the impact of the coronavirus. So said Minister of Finance and Economic Planning Camillo Gonsalves in Parliament today. The tourism sector is one which was hard hit by the global pandemic, causing revenue losses to many who rely on this sector for a livelihood. Among the persons directly impacted are the tour and taxi operators, who have been hit by the premature end of the cruise season and the drastic reduction of flights. In Parliament today, Minister Gonsalves spoke about assistance these operators can look forward to.
Tour bus operators and taxis were similarly affected, as over 30 calls to St. Vincent and the Grenadines were cancelled. The recovery and stimulus package will provide some measure of relief to the 40 tour bus operators and the 497 taxis that are registered with the St. Vincent and the Grenadines Tourism Authority. Tour bus operators will receive a one-off $2,000 payment, while taxi drivers will be eligible to receive a single $500 contribution. And that is reflective of the fact that although we have lost significant cruise tourism, a good portion of the cruise season had already been completed by the time the cancellations began.
The finance minister said omnibus operators too have been hit hard, and that along with a monthly stipend, some will be able to benefit from the provisions being put in place for taxi operators.
Minibus operators are an indispensable feature of Vincentian life. They are also uniquely affected by the pandemic. Physical distancing guidelines, the early closure of schools, the increase in work from home and telecommuting options, and the general economic slowdown have conspired to sharply reduce ridership and revenue. Minibus operators are under real pressure. However, there are over 1,400 minibuses in operation, making any bailout an extremely expensive proposition. Nonetheless, the recovery and stimulus package will provide each minibus operator with a monthly stipend of $250 for the next 3 months to each operator, a few of them who will also be eligible for the taxi and tour bus payment. This monthly stipend, coupled with the fortuitous reductions in fuel prices and the forbearance on loan payments at banks, should allow minibuses to make informed decisions about routes, frequency, and passenger loads over the course of this pandemic.
Air transportation is also of critical importance to the economy, especially in the area of tourism, and Minister Gonsalves said measures are being put in place to assist the regional air carrier LIAT cushion the effects of its already strained revenue.
The recovery and stimulus package allocates an additional $1 million to supplement the Tourism Authority's existing marketing budget. This money is earmarked to drive an aggressive burst of post-pandemic advertising that is intended to accelerate the recovery as possible. The continued operation of LIAT is undeniably critical to our tourism sector and to national development. However, the pandemic is causing massive losses at the airline. Almost non-existent passenger load and a plethora of closed airports have grounded LIAT for at least 2 weeks. The recovery and stimulus package sets aside $2.7 million as a capital injection to ensure LIAT's post-pandemic viability. Similarly, lost revenue and cancelled flights at the Argyle International Airport necessitate an additional $1.5 million injection to that facility. All told, these investments in tourism and tourism-related transportation amount to almost $7.5 million.
A number of Vincentian sailors and oil rig workers are said to be stranded overseas amid the COVID-19 pandemic, and Prime Minister Dr. Ralph Gonsalves said arrangements have to be made to bring these persons home. In Parliament today, Prime Minister Gonsalves noted that the 7 persons who tested positive for the coronavirus up to Monday, 5 were cruise ship workers, and that of those who were stranded overseas, parameters and protocols will be put in place under which they can come home.
We are supporting in principle our nationals returning. Secondly, those who are on the the cruise ships, and the same thing would apply with those from the oil rigs, that their employers would ensure that the tests are done, the COVID tests are done, and that they are those who have a negative test. We verify that independently. And then there has to be certain protocols for them to move from where they are to go on a plane to get here, because we don't want persons who are tested negative to be on a plane with other persons who may be tested positive. The same thing if they're coming by a cruise ship.
The Prime Minister said that earlier today he spoke with the Chief Executive Officer of the Florida Caribbean Cruise Association about protocols the employees will have to follow on repatriating Vincentian sailors.
That the arrangements be made here with hoteliers, guest house owners, to have them in quarantine, even if they're tested negative. If even they're tested negative, because the protocols insist, the WHO protocols, that you be tested twice thereafter before you come back into the community. That would mean at about 21 days, 14 days, then the two tests, one immediately after and one a week after. And that they will have to pay for the hotel, the guest house, to keep those persons. And that they would have to pay for the security, all the arrangements to be made naturally to have the place sanitized and all the rest of it. They would work that out with the hoteliers.
Meanwhile, opposition leader Dr. Godwin Friday gave support to the Prime Minister's position to bring home the Vincentian sailors and oil rig workers who are in the Gulf of Mexico.
We all share the concern of their family members here, and certainly we would wish for them to be able to return home with the necessary guarantees, of course. And that is to ensure that the quarantine measures are in place and that they are properly enforced. It is not just the cruise ship members. There are those persons, Mr. Speaker, who, and I spoke to the Prime Minister about this too, who are working on the oil rigs in the Gulf of Mexico. A number of them have called me, and family members, and they're concerned because some of them, they're not working, they're off the rigs, and they are in conditions or circumstances that are really not safe for them.
Meanwhile, Minister of Finance and Economic Planning Camillo Gonsalves said funds are being made available to compensate the brigade of Cuban medical personnel who would assist this country's fight against the coronavirus. Minister Gonsalves said while the Cuban authorities said there was no need to do so, the government believes it is important to show gratitude.
Further, the government and people of Cuba selflessly offered the services of 12 experienced nurses and 4 specialist doctors to join our fight against COVID-19. While the Cuban government insisted that there was no need to provide any compensation for this gift, we believe that it is only fair that they receive a small stipend through the SET program as a small token of our deep and abiding gratitude to the Cuban people. Second, the Recovery and Stimulus Package provides for housing, feeding, and transporting our Cuban Medical Brigade, as well as similar allocations to quarantine local medical staff that may come into contact with infected patients.
Meanwhile, the Minister of Tourism, Sports and Culture, Cecil Mckie, told Parliament today discussions are taking place to provide some support to the many local musicians and performing artists who will be affected by the cancellation of Vincimas 2020. Minister Mckie was at the time speaking on the impacts of COVID-19 on tourism and sports and culture and measures being put in place to cushion the economic fallout. Minister Mckie said activities in the three sectors, tourism, sports and culture, have virtually grinded to a halt, creating a great amount of revenue loss, and with this in mind, discussions are being had to provide economic support for the various artists who rely on the annual Carnival Festival.
Where music is concerned, we have 5 calypso tents, and of course we have the soca and raga soca artists of St. Vincent and the Grenadines. We know that they depend, to a large extent, some of them, on what happens not only for Vinci Mass, but also some of the other festivals that were cancelled. Our discussion would suggest that under these umbrella bodies, that these individuals would make their submissions to the components under which they fall, and a submission will be made to the Ministry of Tourism, Sports and Culture for analysis and determination, although a sum of money has been identified on the possible support. Some of these artists would also need to get information from the entities under which they are employed. So if they're employed to a hotel, a restaurant, they can get endorsements from those bodies that would support the loss of income in that department.
Music provided for the Carnival period is an important product which is exported regionally and internationally. Minister Mckie said discussions are also taking place on how to facilitate local artists with the opportunity to record and have their music exported.
When there is a clearing of COVID-19 and the issues related thereto, we need to still have our musicians, our artists, with the opportunity to have that expertise and what they produce exported regionally and internationally. So out of that sum allocated will be an amount to assist these artists to continue producing music, very importantly. And the suggestion and recommendation is that we have a compilation that would assist us in using that to share with our regional and international counterparts so that they can see that we are continuing to produce material that can be utilized if they have their festivals. Because let's face it, we cannot use our music from last year to have persons bring to their country if their festival is focused on this year. So that is going to be important.
The Tourism, Sports and Culture Minister said provisions are being made to give support to panists, mass bands and the various artisans nationwide.
In relation to PAN, it's important that we keep them engaged so that if the opportunity arises that there can be concerts, that we can put that on later in the year when we get past the COVID challenges. Same applies to mass, where we have 15 mass bands. And one of the things that we are doing as in relation to the COVID response, we have identified the mass bands that have already committed in terms of financial negotiations and arrangements, and the CDC will work with them to get past having the responsibility to address those loans and financial obligations. It is important also that we provide opportunities for our artisans as soon as we come out of this crisis. And through the National Cultural Foundation and Art and Craft, and the Gallery for Art and Craft will provide a facility so that these persons can have an opportunity to move into high gear once we get past the COVID challenges.